All right, well, good afternoon. As I promised, I told you guys I was going to be back, and I'm back. So we are a little bit late, but today is a Friday, April 1st, so we have to deal with a lot of unnecessary jokes. So we were running late, technical issues, obviously. And also like not doing something that you do every week. When you take a 2-week break, then it shows. So that's why you need the best and most experienced surgeons, so then your surgery goes well without any problems. So if the surgeon's taking too much time off, then you don't want to actually trust them. I'm just kidding, but here's the thing. Today is we are going to discuss another topic with Dr. Irgau. Again, April 1st, American Surgery Center. Everyone knows who we are already. We are going to do the new topic, well, the old topic in a new format. So, and I'm going to ask Dr. Erkan to introduce himself. While he's doing that, the video is running on the other screen with our other program providers.
Thank you, Kemal. It's great to be back on Bariatric Friday. I definitely missed it over the last 2 weeks. Again, my name is Dr. Irgau. I am the president of CHRIAS, or Christiana Institute of Advanced Surgery. My specialty is bariatric surgery, which is weight loss surgery. And I have been performing weight loss surgery now for 20 years. And in our practice at CHRIAS, we have the most experience when it comes to bariatric surgery in our area. In fact, we have set up and organized centers of excellence for bariatric surgery in even the large health institutions in our area over the years. With my colleagues at CRIAS, we are by far the most experienced group when it comes to bariatric surgery.
So, Dr. Erkan, today we are going to discuss the vitamin issue, vitamin deficiency. But I think I checked our old sessions, and there are a couple of things. Actually, if you can, maybe if you can start with the qualification of the bariatric surgery first, and then before and after, I do have some questions on the vitamin deficiency, because we make this mistake, and I just want to tell this first, so then since we don't rehearse these things, so this is just happening as it is now. What I realized when I was going through some of our old sessions, and I probably make that mistake a little bit more. Well, actually, I make that mistake so because it's only 2 of us, so then I can say that there are more people here. So what the population is struggling in terms of morbid obesity, people with morbid obesity and people without morbid obesity, vitamin deficiency means something a lot different for these group of people. So I just want to make sure that I want to say that from the beginning, so that we can kind of stay around that, so then people understand that this is not just for any other vitamin deficiency, and then why it's extremely important for our bariatric population.
Absolutely. So this is a critically important point, the issue of vitamins and micronutrients after bariatric surgery. So what is bariatric surgery? Well, as we've said before, bariatric surgery is by far the most effective treatment we currently have for morbid obesity. And what is morbid obesity? Well, morbid obesity is a chronic disease that is associated with multiple health problems. And it is a problem of excess weight accumulation. That is it, right? But how much excess weight does one have to have for them to qualify for bariatric surgery, for their condition to be known as morbid obesity? Well, generally, we talk about a person having accumulated over 100 pounds over their healthy or ideal body weight. So if a person's ideal or healthy weight is supposed to be 150 pounds, and then over time they gain 100 pounds, now they've reached 250 pounds in their weight, that is the definition of morbid obesity. Another way for us to express that is to talk about body mass index, or BMI. BMI or body mass index is a number that is calculated by putting together the height and the weight of the person. So what is a normal BMI? A normal BMI is anywhere between 18 to 25. And what qualifies a person for morbid obesity? What BMI? And that BMI is a BMI of 40 or over. But sometimes even a body mass index lower than 40, between 35 and 40, can be categorized as morbid obesity if that person also has already developed certain illnesses that are related to obesity, such as type 2 diabetes, high blood pressure, sleep apnea, heart disease, and so forth. So bariatric surgery is a treatment that we apply for morbid obesity, this severe illness. And as you correctly said, after bariatric surgery, because of the alteration in anatomy, it is essential that a person is compliant in taking vitamins and certain minerals for them to stay healthy after their weight loss.
So I'm going to start with some basic questions.
Sure.
I start taking the vitamins this Monday as a bariatric patient. So are we talking about before or after bariatric surgery?
So it's interesting. If you look at our society currently, Kemal, because we don't have access to fresh food, almost all of us, we will need multivitamins on a regular basis, right? Vitamins are organic compounds that our body needs in very small quantities. Our body is either unable to produce those substances by itself, or it cannot produce enough. So it needs them from the outside. It needs them from the nutritionists that we get, right? All of these compounds are found in different foods, but those foods have to be fresh for us to get them.
So that's exactly what do you mean by fresh food? Like I thought I was eating always fresh food, right? So
well, that's interesting, Kemal, right? So let's say you have a garden in your backyard, and you're growing oranges and pears and apples, right? If whenever you are going to eat fruit, you went to your garden, picked up one of those fruits from the tree and ate it, that would be fresh food, right? But an apple that you get from the store, although it looks like a fresh apple, it's not really that fresh because it probably was picked up about 1,000 miles away from you are, and it probably took weeks, if not longer, to get to where you are. Maybe it was preserved in some fashion for it to stay in an edible form. But as the food stays longer away from its source, the availability of those small compounds also decreases. So when I talk about less availability of fresh food, I mean literally, we don't go and get the food from its source directly, right?
So anything that is we are consuming at that point is no longer fresh.
Absolutely. It may be preserved for it to be edible, but it's not fresh, right? So essentially, all of us living in modern society, and you and I know that there is even a greater proportion of our population that doesn't even eat the types of fruits that we're talking about. Where people are consuming or are using really a large portion of their food comes from preserved foods that have been altered in ways that are unrecognizable in terms of their original aspect, right? So those foods will have very little of those essential minerals and essential vitamins that our body needs. So to make up for that, we have to take vitamins. So that's why doctors tell us take a multivitamin a day. Now, for a person who has not had bariatric surgery, for all of us, we talk about making a habit of taking multivitamins so we stay healthy. But for a person who's had bariatric surgery, it's no longer a question of making a habit. It's an absolute necessity for them to stay healthy. So taking vitamins is an essential part of our education when we prepare patients for bariatric surgery. So, and why is that? Well, because when we do bariatric surgery, there is an alteration in the anatomy which will decrease the ability of the body to take in, to absorb those essential compounds from the food that the person eats. That's why we need them. We need to take them as additional nutrients for us to stay healthy.
So now, if I missed it, I apologize, but from the patient who's going through the process, so let's take, I'll pretend to be one of our patients. So let's say I think my BMI is about 28, but let's make that 48. So the perception is, well, I have enough vitamins, but what you just said is, well, just because I eat a lot doesn't mean that I get proper vitamins in my body. So even before the surgery, I may have these deficiencies. In fact, because I may not be choosing the right food, perhaps my deficiency on the vitamin issue is even greater, because the things that I'm eating, if it's like the fast food or the potato chips and those other stuff, so they don't provide any of those. So now they're going through this life-changing event, and we want them to be prepped even before the surgery. Is that the right understanding?
Absolutely, absolutely. So we want our patients to be as healthy as they can be, for us when they go through the process and prepare, but also from the mindset, we want to prepare them to have the healthy habits that we want them, right? So when I see a patient for the first time and I'm doing a consultation with them, I will be counseling them that they need to be taking multivitamins. I will be counseling them also that after bariatric surgery, this need will be much more crucial and critical, because bariatric surgery will have made some changes in their digestive tract that will interfere with their ability to absorb, right? Now, you talked about a person having already some vitamins in their body, Kemal. Well, potentially. In fact, the vitamins are classified in two types of vitamins. There are fat-soluble and water-soluble vitamins. The so-called fat-soluble vitamins like the vitamin A, vitamin D, vitamin E, vitamin K, those are fat-soluble, means that if we've been taking them in good quantities, they can stay in our body within the fat cells because they're fat-soluble, right? But the ones that are not fat-soluble, Kemal, we don't preserve them in our bodies, whether it's vitamin B or vitamin C, they will be excreted if we've taken them in excess. So we will need them on a continued basis. So knowing that a person has been taking multivitamins even before bariatric surgery is a good start, because it tells me that they have a habit that they will likely be continuing. If a person was not taking multivitamins at all, it's important that they start taking even before surgery. First of all, because even before surgery, they will need those vitamins, because we live in a society where access to fresh food is not there, right? But I want them also to get into this habit of taking those necessary nutrients on a daily basis after their bariatric surgery, because after bariatric surgery, it's no longer a question of having a good habit. As I said, it's a necessity, because, for instance, if a person doesn't take enough vitamin B12, and B12 could be one of the vitamins that is affected by bariatric surgery, they could develop some very serious conditions like neurological problems that can affect their memory, that can affect their irritability, or that can affect even their movement in the long term. And if these conditions are not treated in time, they can become permanent. So there is a very important side to this. It's not just a question, oh, yes, you have to take those vitamins. No, if you don't take them, you could become seriously ill in the long term.
So getting the vitamin before the surgery, we passed that now. Who can provide this education for us? You guys are surgeons. You do what you do best in the OR, of course, with the communication with the patient, but we don't have time to talk about the vitamin issues as much. Like we do provide a lot of webinars and support groups and Bariatric Fridays. Now, actually, we are probably most popular videos in Delaware on bariatric. Top 5 out of 10 our videos are visible, so it's available for everyone. So on YouTube. So when this is available, but we are not the best people for that. So who is the right person, right provider for this education?
Our nutritionists, our dietitians, right? That's why we have nutritionists, right? It's really part of the healthy nutritional habits, right? And they are really best placed to carry this education for us, right? So not only they have actually the most knowledge in terms of the, and the appropriate specialty for counseling patients about vitamins, but also they are able to talk to them about optimization on how to take these medications. Remember, vitamins come in different forms, like they could be tablets, they could be in liquid forms or other forms, right? So what are the ways in which this particular patient will tolerate these vitamins, okay? What kind of flavor will be best for them, right? And what kind of timing will likely be better for them so that they are compliant with it. These are all individual discussions that our dietitians are really well placed to discuss. In terms of what are the really important ones that we look for, Kemal, as I said, vitamin B12 is an important one. Vitamin D is very important. In terms of the minerals, calcium and iron, these are probably the 4 critically important that we talk about in terms of post-bariatric surgery deficiency and the importance of taking them on a regular basis.
So for our patients, are they able to buy these from anywhere, or do they have to buy that at CHRIAS?
So no, absolutely, they can buy them from anywhere, but there are certain preparations that make it easy for them, right? The certain compounds, for instance, when they need, a certain amount of vitamin B12, which is generally anywhere between 500 micrograms to 1,000 micrograms a day, depending on where the patient is when they are starting. When it comes to vitamin D, and we recommend anywhere between 1,000 to 3,000 international units a day of this. When it comes to calcium, and we recommend a type which is called calcium citrate preferentially for patients to take up to 1,500 milligrams a day. When it comes to iron, and we recommend up to 18 milligrams a day, and in certain situations, particularly in young women, we recommend even higher doses because with their menstrual cycle, they tend to lose more iron than other people. So certain compounds like, and I don't want to talk about particular brands in this setting, Kemal, but there are certain brands that actually incorporate those vitamins and nutrients in a way that they may be easily taken by the patients, right? So there are certain compounds, like for instance, calcium, we would like those to be taken, in intervals during the day as opposed to all at once, because that improves their absorption. But when it comes to B12, when it comes to iron, when it comes to vitamin D, if we can get them those compounds in which they can really take them much more easily, that is best. So at CHRIAS and in other bariatric programs, very often there are preparations that are suitable for bariatric patients in terms of convenience. Not that they are better vitamins, but in terms of how their compound is prepared, makes this a lot more convenient for the patients to take. So in the final answer would be, yes, we have them at CHRIAS. They can buy them at CHRIAS as well, but they can buy them from anywhere else. The important thing is that the patients take them on a regular basis.
So one of the you mentioned, but I'm just going to ask you maybe in a different way. Iron deficiency is something that we see during the case conferences. That's with the hemoglobin. Usually, if it's under 10, that kind of trigger our attention, and then we would be looking at those patients a little bit closely. So we see that more often than other deficiencies on vitamins. So can you elaborate that a little bit? Do people have more iron issue than other
Sure. So we are obviously talking about micronutrients in general. So we're talking about vitamins and we're talking about minerals as well. So iron would be within the minerals category. So you are absolutely correct. We do see iron deficiency even before bariatric surgery in many of our patients. And there is a very clear reason for that, Kemal. And that is because for a number of reasons, the vast majority of our patients happen to be women, right? And women are at higher risk of iron deficiency, as I said, because very often a combination of menstrual cycle and inadequate iron intake in their diet leads to deficiency over the long term. So when we do blood work, which is the first thing we do very often among the different evaluations that we do for, when we start the bariatric program, we see iron deficiency in terms of a hemoglobin that is on the lower side, essentially. And sometimes it could be so low that we would recommend even extra iron supplementation way higher than the daily requirement so that they can build up their iron stores.
And some of these things should be identified by the primary care providers if the patients, this is like the accountability on both patients and the primary care providers. Annual physicals are the extremely important visits with the providers, with the PCPs. And once we had the blood work, that's the only way that they can actually know if there's any deficiency. And sometimes we see the patient, they're coming in and then they don't have any blood work prior. And then we're like, well, how is this patient until this point? How did they get to this point how they manage getting to this point without having any blood work? And that's, on one hand, I feel good about helping those individuals, but on the other hand, like we are kind of questioning the prior process. Why are they not getting that? Patients should know that too. So now, other than these, what's next most important one that we see?
So we talked about iron, right? The other one that we see very often being deficient is vitamin D, right? Vitamin D is a very important vitamin that is critical for the metabolism of calcium and for the mineralization of our bones, right? As it happens, vitamin D requires also sunlight for it to be activated, right? So we have to have exposure to good number of months within the year to sunlight for us to be able to have adequate amounts of useful vitamin D in our body, right? Well, very often, that doesn't happen. We live in zones that don't have as much sunlight, or our ability to expose ourselves to sunlight may not be as much. That coupled with the fact that, in our diet, there is decreased vitamin D and we're not actually taking additional vitamin D leads to this deficiency that we see very, very commonly. So one of the blood tests that we do when we start the bariatric program includes vitamin D. And as you correctly said, we see a lot of deficiency. And we do send supplementation at much, much higher doses than the ones that are recommended in order to build up the levels of vitamin D that patients will have. After surgery, it's also very critical that this continues. And as you know, in our program, it is part of our protocol to do blood tests on a regular basis after bariatric surgery for us to be able to evaluate the possibility of deficiency after bariatric surgery, so our patients can be given the supplementation.
So I'm going to say what I'm about to say, I'm going to take out loud. So just to make sure that everyone understands in the same way that I understand. I do pretend very well, by the way. Some of these I don't know the answers, but I have to ask them anyway. So now we are not talking about because of the bariatric surgery, you now have vitamin deficiency, right? So this is something that is already happening. So I just want to make sure that we kind of underline that, highlight that, because I was in Turkey for 2 weeks. Everything that I know in my business, in my industry, wipe everything out because you are with your mom and the two sisters. They know everything. So they're all doctors. They're not. They don't have all the specialties. They don't. They know everything, but they don't. So, and then I'm like, I come back here, I'm like, are we like really, which way is right? Like, so because it's some part of it is coming from the societies that we live in, and then the other part is coming from what we do best here in the United States. So it's difficult sometimes to explain someone why we have to cut someone's stomach. Like that's still like, time to time I use the example of my mom, but it's free, no copyright, so she doesn't charge. So she's like, you guys are doing the your cutting stomachs? Like, well, yes, but these patients, I have to explain every time, these people are dealing with a big chronic illness. It's like a huge issue for them. It's the origin of the other problems that they are dealing with, diabetes, the hypertension, and this sleep apnea. And just going through this, and we are kind of on autopilot, so then I can just talk about these in my sleep these days. So, but there's still something that's not clicking. So, and it's not just with the patient actually, and sometimes primary care get upset with me, but I'm not really blaming, but I just want the behavior to change because I cannot let the patient leave my office, a patient who has BMI 51, and they have hypertension and they have hyperlipidemia and then they have sleep apnea and then they have BMI 51. A patient didn't bring it up, so I was sensitive. So when I heard their feelings, I'm not going to address the morbid obesity issue. I mean, we see this less and less in our ACO, but I know when the patients are coming from outside of the ACO, we see this primary care not having that, the main, whatever they learned 30 years ago, 20 years ago, they're just following that, but things change in the last 15 years. Mm-hmm. So, and there's still that, glitch or disconnect, whatever you want to call. And, one of the reasons that we are doing this event is because maybe we'll get 10 more people to understand what we are doing. So I think where I started with, it's not the bariatric surgeon making you, the patient, vitamin deficiency. They're not getting that from the surgery, but these people are already dealing with these, but it will become more severe because their eating habits are going to be completely changing. And it's a new life, new healthier life. So they have to have new healthier habits. Is that kind of like a good summary?
Well, absolutely. So let's, the first part would be, why are patients having vitamin deficiency even before bariatric surgery, right? Mm-hmm. And we talked a little bit about that. But that is really illustrates the disconnect you mentioned, the paradox that we have in our society. We live in a society of plenty, right? We are heavy because we have excessive food, but at the same time, we're actually malnourished, right? So when you say somebody is malnourished, generally you talk about somebody who really has lost weight, is very thin. That's the idea that we have. But you can be very heavy and malnourished, Kemal, right? If you don't have the right nutrients in your body. If your bones are becoming wasted because you don't have enough vitamin D, right? If you're starting to show problems neurologically because your vitamin B12 is low, right? Or if you are fairly weak and anemic because your iron levels are low, right? So you could be heavy, right? And you have all these problems, and that classifies as malnourishment. So that's why we do look at our patients, blood tests, even before bariatric surgery, to make sure we know where we're starting from. So it is not because of the way our society is set up in terms of its distribution of food, right? You go to the stores, shelves are full of food, but none of those foods are necessarily healthy, fresh foods with all the micronutrients and the vitamins that we need. In fact, we could probably guess that the vast majority of the foods that we see on the shelves on an ordinary supermarket have very low nutritional value from that point of view. And we live in that society. Yes, it satisfies our hunger. Yes, it satisfies our craving for sugar, for fat, and things like that, but it doesn't give us nourishment properly. But this is the society where we are. And that's obviously what we have to deal and what the primary care doctors have to deal as well. But to make our patients healthy, we have to look at for these things, right? And then you add to that, obviously, bariatric surgery that we're doing to get rid of morbid obesity, which is this very severe chronic problem that leads to many health problems. And the way we do bariatric surgery is by altering the digestive system. And we alter the digestive system in such a way that that person actually will be able to take less food, less nutrition into their body. And that will also affect the proportion of micronutrients, of vitamins that they are able to take in. So if they were malnourished from a vitamin lack point of view before the surgery, they will be even more malnourished afterwards if we don't prepare them well and if we don't set them up well to take care of that by making sure they take B12, by making sure they take vitamin D, by making sure they take calcium, by making sure they take iron, and all the other multivitamins that are found in a multivitamin compound.
Yeah, that makes a lot of sense. Now, just kind of like a random question, but how many total pills am I going to take?
So that could be up to 6 a day. Okay, and the reason for that is because we do want to, particularly calcium, we want to take it in not at the same time. So I talked about taking at least 1,500 micrograms of milligrams of calcium, but we want them to be taken in intervals, like 3 times or 4 times during the day, because that increases their absorption, right? We will be taking vitamin D as well. We will be taking B12 as well, and we will be taking a multivitamin as well, right? Now, sometimes, depending on where the person is starting and what their real deficiencies are, our dietitians are able to guide them in a way that will be taking less pills a day, but satisfy all the requirements, right? But this is not the same for everybody. That's why it's important that when they are meeting with our nutritionists, their particular situation is taken into account and they're given good guidance so that they will be taking these medications regularly. Now, in terms of how many you are taking, Kemal, remember, we are eating a number of times a day, right? So if we take a habit of taking our vitamin, our mineral, our multivitamin with a specific meal or snack that we have in a day, we can incorporate it very, very easily within that. But that requires habit building. Is everybody able to do that? Absolutely not. Is everybody going to be compliant with that? Absolutely not. That is why we want follow-up of the patients with our office on a regular basis for life. And that's why we do blood work on a regular basis, also to make sure that they are not falling behind with these requirements. So for instance, after bariatric surgery, as you know, we do blood tests at 6 months and then at 1 year. And then after that, at least once a year, we do tests. But we do them obviously more frequently if we are suspecting the deficiency because patients are showing us symptoms or we get other indications.
So again, maybe as a reminder, what you said is really important. So just because we do the surgery doesn't mean that we stop our relationship with the patient. Actually, that's the new term is starting with them, but under the wellness, well-being, and we are still seeing our patients on a regular basis. And that is also kind of part of our accreditation for the Center of Excellence for Bariatric as the #1 program in Delaware. We take this extremely seriously so that we don't want anyone to not to follow through the proper post-operation guidelines. And that's one of the challenges, because sometimes, in some cases, when you take a patient with 320 pounds and then 7 months later, now they are 170 pounds, then they don't feel like they want to come to the office for follow-up visits. But please do, because that's important. We want this to be long-term. We want this to be healthy. And we want to also be there when you need the most help before it's late, so that we can identify those issues. Now, there are different, level of providers. After the surgery, it doesn't have to be necessarily the surgeon seeing the patient every time, but between the primary care, we have our multidisciplinary approach. We work with the primary care very closely. We do have a bariatrician who's not a surgical person, so not every program has that provider available for them. Our nutritionists, they're available, and we are really just making these available as good as possible. So we just want to make sure that patients can take advantage of that. Now, when we look at this list, Dr. This one is a picture, so it won't move. So you don't have to do it too quickly. So it stays there. So just comparing the two populations, with patient with morbid obesity and patient without morbid obesity, someone should still be getting their blood work checked to make sure that they can actually they can identify these deficiencies in a timely manner, right? So we don't want, you don't have to be a bariatric program patient. You don't have to have morbid obesity to look into these, because especially as we are getting older, and especially in I think female population is more affected by this than the male population. So we need to take this from the prevention approach side, not like after it happens. So hopefully this gives some light for those individuals who are looking for answers in the vitamin deficiency. So I don't have any other specific questions, Dr. Irgau, on this. Did you want to add anything?
Yeah, I mean, I think we've gone through the important points that we wanted to talk about today, which is the importance of vitamins and minerals supplementation after bariatric surgery. And the ones that I want people to really focus on would be vitamin B12, vitamin D, calcium, and iron, essentially, right? So they have to take multivitamins. They will have all these components, but very often they will need extra of these four nutrients that I mentioned for them to stay healthy. The other point I want to make is I did say that we do blood work on our patients after the surgery on a regular basis, but very often, Kemal, to credit, giving credit to our primary care colleagues, they do those blood work themselves as well on our patients. So we do check for that, and if it's been done, there is no reason for us to repeat it. Very often, some patients that I haven't seen for 3-4 years, that's the first thing I will ask them: have you had any blood work to check on your vitamins? And they will say, yes, my primary care doctor is on it, and I've been doing it on a regular basis. I've had this supplementation from them. So that also happens. So as long as, we're all focused on doing the, right care for our patients, whether they get it from the primary care doctor, whether they get it from us, as long as those levels have been checked, we're very comfortable. The worst thing for us to see is bariatric patients not being followed up at all afterwards, because that could be really, could put their long-term health at risk, especially if they're not following up on the recommendations that we've made for them to take the vitamins and minerals necessary.
Absolutely. So I had one other, not related to vitamin deficiency, but from the program standpoint. So I didn't have time to put it all together, and it's on my iPad. So like people, they know by now that I have like 5-6 different computers in front of me. So just transferring from one to the other was a little challenge earlier. So, but I just want to share this with you. I look at our patient satisfaction scores, but I look at it because the number is almost 100%. So I went to August 2021. Out of 162 surveys, we have 161. They would recommend our facility to a family member or a friend. That's 99.4%. And the same report in December, out of 160 this time, this is, it's a running total. 159 out of 160 would recommend us. That's 99.4%. And then the latest one that we have is total of 157 total surveys. It doesn't include March. This is as of February. And 156 out of 157, which is 99.4. So we've been
that's great. That's wonderful to know. Yeah.
Rate, which is not common. And this, a lot of credit goes to our providers, our nurses who are extremely essential, and our program. And we are extremely happy to be able to provide the service and then make changes, make differences in people's lives. So
absolutely.
Thank you so much for joining me today, and we'll be back.